working as one group. You're going to be on a search and rescue mission. We just got word that there were 2 hikers out together, and they seem to have veered off track and are lost in the woods. We're not sure if they have any injuries or what happened to them. They were last seen with the rest of their group about 30 minutes to an hour ago.
We started this in 2008, and the goal was to expose them to more austere medicine, and so we primarily train in a hospital with every possible resource. Yet a lot of people's goals are to go out and do international medicine, or maybe work in more rural areas, or do just humanitarian aid. And I don't think our medical training really gives us much of a feel of how that can be. And so while this is a wilderness setting, we often focus on wilderness injuries, just the practice of medicine in an austere environment. I always ask everybody at the beginning of the course, what they're going into and what sort of experience they've had. And I think more and more, the students have had actually less outdoor experience, but sort of want to see what it's like, want to try something new. And it's been a change in how we teach things. It's been a change in how you address leadership roles, how even you go about camping and things like that, because some of them have never been camping actually.
We got C-spine, head injury we can't touch right now. Abdominals got compression, left femur's out.
Working as a team is certainly something we stress. They do a great job of doing that, and falling into different roles and using everybody's strengths to solve a problem is really fantastic to see. It's really rewarding to see. A lot of us, this is their last rotation in med school, and so this is sort of their last big test, and it's fantastic to see how far they've come in 4 years.
Hey guys, just a quick status update. We have Dr. Broughton on the litter, still not responsive, but we're ready to transport. What's your status?
They don't have fancy tests, they don't have x-rays, they have to do a good physical exam, they have to do a good history, and things that they normally wouldn't do, cross the stream with a patient, or scrape a spider off of somebody's face, keep the sun out of their eyes, things like that. I think it's really beneficial for them, and that's one of the reasons why we do it, and it's great being outdoors too. It's been really fantastic, again, really rewarding to get people enthusiastic about the outdoors, because that's something that I've loved, and I find it a good mental release too. I mean, it gives you some solace and some quiet time, and it's good to expose people to that sort of thing too.
You want to put him down and wait for the helicopter?
3, 2, 1.
Congratulations! You have saved both of your victims!